welcome to the second annual Sadie Strong Health and Wellness Expo. We are so excited to have you here with us this afternoon. I hope you enjoyed the slideshow that just highlighted some of the activities and programs that we've done this year. It's been an amazing year, even though there are a lot of things that are going on right now. You know, we're really just excited that you're here. So let me tell you a little bit about Sadie Strong and our purpose today. So Sadie Strong is a 501c3 nonprofit organization, and we promote the early detection of breast cancer, and we inspire healthy lifestyles. So we are presenting this program to you today as a part of our Breast Cancer Awareness Month. And we know that this month is not enough time for us to really talk about all the issues that plague women and women's health and inspiring healthy lifestyles. But this is our opportunity to try to equip you with some information and knowledge that can help inspire you to learn more about your body and live a healthy lifestyle. I want to start by thanking our event sponsor, Breast Care of Western New York, which is our Pearl Hope sponsor for this event. Thank you so much for sponsoring us. We have a great program scheduled for you today. We have a health and wellness panel with two amazing doctors. We have a fitness demo, as well as a cooking class. So without further ado, we're going to begin to start with our Women's Health panel and question and answer with two amazing doctors, Dr. Mariola Paz and Dr. Emikule Nylander. Each doctor will share health information, and then we'll come back together to answer some questions. So you'll have an opportunity to post some questions in the chat that you can ask the doctors after they finish speaking. So let me first introduce Dr. Mariola Paz. Dr. Paz specializes in surgical oncology. Her practice is Breast Care of Western New York, which is a member of the Roswell Park Care Network. Breast Care of Western New York offers women of all ages comprehensive surgical breast care for both benign and malignant conditions, including high-risk evaluation and screening. Dr. Paz is also an assistant professor of oncology at Roswell Park Comprehensive Cancer Center. Welcome, Dr. Paz.
Thank you very much for allowing me to participate in this wonderful event. I think it's just great that you're providing this education and this information for everyone out there, because it's so very important. So I prepared a few slides just to talk about some of the things that I know people might want to hear about. There's not great detail in a lot of it, but I'm certainly happy to take questions afterwards. So I'm going to pull up some slides that everyone can see, okay?
Okay. Isn't technology amazing?
It is. Okay, so can everyone, does that come up okay for everybody? Okay. All right, so let's talk about breasts, right? That's what we're here to talk about today, breast health. So I just wanted to talk a little bit about what breasts are and what they're made up of, because it kind of falls in place with some of the things we're going to talk about later regarding cancer. So the breast tissue lies on the front of our chest, obviously. It's from your collarbone down to your abdomen, and then from the middle of your chest out to your underarm area. And the role of breast tissue, obviously, is to produce milk. So breast tissue is made up of different structures. Some of it is just fatty tissue, and then we have ducts and lobules in our breast tissue. So lobules are where milk is made and stored, and then the ducts are where the milk is carried out to the nipple to provide for breastfeeding. So I get a lot of patients asking me about what is normal when it comes to their breast tissue, because we all come in different shapes and sizes. So things that are normal and tend to be not anything to worry about include your breasts being different sizes. And usually it's very minor that you can't really tell too much a difference, but sometimes it can be more severe. Some women actually have a whole cup size difference within the breast that can be normal. Your breasts can hang differently. One breast can hang a little bit lower than the other, and that's typically nothing to be concerned about. It's normal to have hair around your nipples. The majority of women do. Pain in the breast is also very common. So breast pain is really a common symptom that women have, particularly when they're still menstruating. So around the time of your cycle, it's really common for women to have some discomfort. And occasionally milky or creamy discharge, particularly from both nipples, is something that is normal. We call that physiologic discharge, and we don't tend to get too concerned. So what is abnormal? What should you bring to the attention of your doctor if you discover on yourself in an exam? And we'll talk about how to do self-exams a little bit later. So any new mass. So any mass that's hard, firm, nothing you've seen before, you should be addressed by your physician. Sometimes women are prone to cysts, which can fluctuate with your menstrual cycle. So things that come and go also tend to be benign. But if you experience something, it's not going away, it's new, then you should definitely have your doctor evaluate it. And even if you are prone to cysts, any new mass should be evaluated, because you can't assume just because you've had cysts in the past that this new finding is the same thing. So it's very important to always get checked out if you have anything new in your breasts. So skin redness is another symptom. Oftentimes it can be inflammation or infection, but it can be how breast cancer presents also. It can present in the skin. So nipple discharge that happens on its own or is clear and bloody. So if you notice drainage from your nipple, particularly on one side that has any blood or looks clear like water, that is more concerning for growth in the breast, and we'd want to have that evaluated by your physician. Also, any new swelling in your armpit area, cracked and bleeding tissue from the nipple, or pain that's just in one spot that doesn't change with your cycle or activity and it's persistent, that might be something more concerning. So that's something we'd want to get evaluated also. So a lot of our discussion with patients is about their risk. So what affects your risk for breast cancer? So these are some of the main things that we evaluate when we meet people for the first time. So one of the things is the age that you start your first period. Family history obviously plays a role, but you know, when we talk about breast cancer, it's caused by a number of different things. It's not just one thing. So certainly family history is important, but like your slideshow said, most people who develop breast cancer don't have a family history. So we certainly take that into account, but there's other factors also. So the number of pregnancies that you have, the age of the birth of your first child, age of menopause, and then any use of hormone replacement therapy after menopause. So what is the main thing that links all of these risk factors? And that's estrogen, okay? So the reason why those things are relevant is because they relate to estrogen in some kind of way. So estrogen is a natural steroid hormone. So we all have it in our bodies, even men. We all need it for certain things. It's produced in our body and it regulates the function of certain cells and other organs in our body. So for women, it helps breasts develop, regulates our menstrual cycle, the thickening of the lining of the uterus, and then it also prepares the breast to produce milk for breastfeeding. In men, it's involved in libido and other various functions. So it travels through our bloodstream and then sends signals out acting upon other cells to do its work. So we know that prolonged estrogen exposure can be associated with an increased risk for breast cancer. So that's why women who get their period at a younger age, so the average age maybe 12, 13, if you get your period at 9, 10, that's more time to be exposed to estrogen. If you don't have pregnancies, that's more time where you have this, you're getting menstrual cycles and then you have more exposure to estrogen. So women who develop menopause later in their mid-50s, later 50s, also for the same reason. And then also, so those are things that we necessarily can't control, but there are some things we can control, like hormone replacement therapy. So that's a treatment that women get when they go into menopause to help subside some of the symptoms that can be quite severe when you're going into menopause, like hot flashes and night sweats and fatigue and things of that nature. But we know that too much of that also can be associated with the increased risk for breast cancer. So other risk factors. So yes, alcohol can increase risk for cancer, and it's not just breast cancer, but a lot of different cancers. So we know, so women who drink a significant amount, so 2 to 3 drinks per day, it's been quoted that they have as much as a 20% higher risk of developing breast cancer. So limiting alcohol is important, and 1 to 2 drinks per week is considered low and not much risk, and certainly no more than 1 per day, okay? So other things that can lower estrogen. So breastfeeding. So if women are able to breastfeed after they deliver a child, it's always a good thing because breastfeeding can delay the menstrual cycle for a lot of women, so that can help decrease that exposure. Maintaining a normal body weight. So as the slides also said in your earlier presentation, increased being overweight or being obese can be associated with an increased risk for breast cancer, particularly when you're after menopause. And the reason for that is that fat tissue makes estrogen. So the more of it you have, the more estrogen you have floating around in your body, which can then be associated with that increased risk. So alcohol limitation. Alcohol actually can increase estrogen in your body as well as tobacco use. Smoking can increase estrogen. So limiting those is very important. And then exercise. So exercising every day, at least 3 times a day, 3 times a week, excuse me. Whatever routine that you can incorporate into your schedule is important. And I have a lot of women who think they have to do something an hour every day or whatever it is. I mean, I always tell people to do what they can, start small, start with 20 minutes a day, whatever you can do to get that first step going and incorporate it into your schedule. The first step is always the hardest. So when should you start having mammograms? So there's been a lot of different guidelines, recommendations out there. But as per the American Society of Breast Surgeons and the American College of Radiology, they still recommend women who are average risk starting mammography at age 40 and continuing every year thereafter. We don't recommend an age cutoff like some of the other guidelines do. There's the US Preventative Task Force had recommended stopping at age 74. But honestly, women are living longer. People are being healthy longer. So as long as your life expectancy is over 10 years, then it's encouraged to continue screening mammograms. And, going for mammograms can, not always be the most pleasant experience. So sometimes I have patients that say they always go with their sister, they go with their daughter. They make it a team effort, and it can help it be a little bit more pleasant. So I just wanted to show a picture of a couple of different mammograms, because one of the other things that I get asked about nowadays a lot is breast density, okay? So breast density essentially means how your breast tissue looks on a mammogram, okay? So you can see there, it goes from fatty to extremely dense. And the reason that this is important is because when you get a mammogram, abnormal findings are white. They look white on a mammogram. So you can imagine that if your tissue is more fatty, it's going to pop out really well in the background of a gray or a black, as opposed to all the way to the extremely dense, where you can imagine if there's a 1 centimeter speck of white in the middle there, it's going to be very, very difficult to see. And that's where density makes a difference. So it's very, very common, particularly in younger women, to have dense tissue. And generally, as we age, the breast becomes less dense. But that's not true for everyone. Some women have dense breast tissue their entire lives. So in women who have dense tissue, nowadays, one of the things we're able to offer is 3D mammography, which is great. And it's really becoming just the new baseline standard for all mammograms, but that allows us to have a much better picture through the breast tissue. And then some women are candidates to also get ultrasound potentially, and sometimes even breast MRI if necessary. So just some statistics about breast cancer. So about 250,000 women every year are diagnosed with breast cancer. And unfortunately, about 42,000 women die of breast cancer every year. So that's why the screenings are so important. As your slide said, breast cancer is the second leading cause of cancer-related death, second to lung cancer in women. And it's the most second common type of cancer found in women after skin cancer. So just a few things about breast cancer in general. So generally when we get a diagnosis of breast cancer, invasive ductal cancer is the most common type that we see. So that's where the cancer cells start in those ducts that we talked about right at the beginning of the talk, okay? The second most common type that we see is invasive lobular cancer, meaning that the cancer cells start in the lobules of the breast tissue that we talked about. And then there's an entity called ductal carcinoma in situ that some of you may have heard about. And this is considered actually non-invasive stage 0 breast cancer. And it often presents not as even a mass or a tumor on imaging, but presents like little calcium deposits. And this is the earliest type of breast cancer that we can find. And nowadays, because of mammography and early screening, accounts for about 20% of all those kind of cancers that we see. So one of the other features about breast cancer that we look at is to see if breast cancer is actually driven by hormones in your body. So the majority of breast cancer that gets diagnosed is, and that's why we look for, when we get the diagnosis, we look for something called an estrogen receptor and something called a progesterone receptor. And if those are positive, we know that the cancer is fed by hormones. That means the cancer is ERP or positive. And if those are negative, then the cancer is not fed by hormones, and that can affect treatment after diagnosis. So just quickly about staging. Staging nowadays is very complicated. It's very involved. It encompasses a lot of different things. It is based on the size of the tumor, if there's lymph nodes involved, if there's spread beyond just the breast and the lymph nodes to other parts of the body. So it can vary from stage 0, which is that DCIS type of cancer, to stage 4 cancer, which is when cancer cells have spread the lungs, the liver, the bones, or the brain, which are the most common sites where breast cancer cells can spread. And the stage that you are will obviously dictate what treatments are appropriate and available. So who is part of the team? So breast cancer treatment is multidisciplinary, meaning that most people are going to have more than one doctor as part of the team. And treatment is divided into 2 separate categories for people. So there's local treatments, which are surgery and radiation. And then there's systemic treatment. So those are treatments that affect your whole body. And those are chemotherapy and what we call endocrine therapy, or specific pills that are anti-estrogen pills that are targeted, again, that can target those hormone positive cancers. So most people are going to see a surgeon, a medical oncologist, and a radiation oncologist because they all play a role in the treatment planning. I just want to say a few words about men and breast cancer also. So male breast cancer is rare. It encompasses less than 1% of all breast cancers. So about 2,600 men are diagnosed per year. And because men don't really think, a lot of men aren't aware they can get breast cancer, unfortunately, oftentimes it can present at a little bit later stage because they're not aware or they're not sure what they should be aware of or what they should be concerned about. So the lifetime risk of developing breast cancer for a man is about 1 in 833. So there's no screening recommendation for men who are of average risk. and even men who are found to have one of the gene changes that can lead to an increased susceptibility for breast cancer. As far as breast cancer risk, it's still lower, believe it or not, than the average woman. So just a yearly clinical exam is recommended for them, but more importantly for men who have a genetic predisposition is prostate cancer screening, because that is the much higher risk in those men. So lastly, I just wanted to show a good way to do a self-breast exam, because I have a lot of patients who say they're just not sure the right way to do it, or they're very concerned, they're not sure what they should be feeling for. So one good way to start, so pick about the same time every month. You can stand in a mirror. First thing to do is when you're standing up, just inspect your breast when you're in the mirror. See if you see anything that looks different. Any skin changes, any pulling, any retraction, any lumps that are visible when standing. And then you can lift your arms above your head and then look for those same things. And then when you lie down, you can put your arm above your head, and with the opposite hand, using gentle pressure, just kind of, you can go in any of these three patterns. Some people go in a circular motion. Some people go, kind of in a clock pattern or straight up and down, just so that you're getting to feel all the areas of your breast, so that you can get a sense of how your breast tissue feels. And everybody's breast tissue feels different. So what's normal for you might not be normal for somebody else, and that's okay. But if you're ever unsure, then you want to get a breast exam by your physician. So these are just a couple of websites that are good resources for having information regarding screening, breast cancer, risk evaluation. NCCN, which is the National Comprehensive Cancer Network, has a lot of information for patients. Breast360.org is the American Society of Breast Surgery website that has a lot of information, particularly about cancer, but also benign issues that women have, and obviously the American Cancer Society website. So please get your mammograms. Early detection matters. It makes a huge difference. So that is the take-home message. And thank you so very much.
Thank you, Dr. Puff. That was awesome. Awesome. Great information. It was wonderful. Thank you so much. I know we'll bring you back for some questions. So if you have questions for Dr. Paz, please begin to put them in the chat, and she'll be back shortly. So thank you. Our next doctor that will join us today is Dr. Emikule Nylander. Dr. Nylander specialized in obstetrics, gynecology, and gynecological surgery. Her practice is Buffalo OBGYN, and she also serves as a clinical instructor at the State University of New York at Buffalo's medical school. Dr. Nylander is the founder of a 501c3 nonprofit organization called the Medical Outreach and Community Assistance of Western New York, or MOCA, which has performed over 100 surgeries to disadvantaged men, women, and children in Ghana and the Dominican Republic since 2007. She's doing a great work there. So we'd like to welcome Dr. Nylander. Welcome, Dr. Nylander.
Hi, everyone. Welcome to the second annual Sadie Strong Wellness and Health Expo. I'm so glad to be here. Thank you, Sadie, for allowing me to participate once again. I always love seeing the women and also seeing you. As Sadie mentioned, I am an obstetrician gynecologist with Buffalo OBGYN. We are 4 female physicians who joined our practice in 2010. I like to talk about what is expected from a patient perspective when they come into my office, and when they come to see me, what do I want from them as well. So when a patient comes to me, I expect them to know their health history and know their family history. And so I encourage a lot of women now to get that in for that additional information from your mom, your grandmother, your aunts, your uncles, because it's pertinent to your health, okay? I thank Dr. Paz for her wonderful presentation, because that helps people to understand what they need to do in order to improve their health. So I always encourage breast self-examination. It's important for you to know what is different on your body, what changes have occurred, in order for me to be able to help decide if this is something that needs to be addressed immediately, or is it something that's normal and we can watch over a certain amount of time. I do show young patients as well, starting from the time they start to come see me around age 16, how to perform a breast self-examination, okay? And when is the best time to do it? I think it's important as young women grow that they know that their bodies are changing as well, especially during adolescence, and what those changes are. And even as an adult woman, you need to know that the skin changes and certain spots may come up that are our aging spots, not necessarily anything worrisome, but you need to know because you can get melanoma on the breast as well, okay? I personally had a father pass away from breast cancer. So that's where your family history comes into play. Because I do have all of his aunts on his mother's side had breast cancer or ovarian cancer. So that put him at risk. And it's important to know these things. We as women, unfortunately, tend to be the caretakers of everybody else, and so neglect our own care. And sometimes when I see a patient, it's surprising that I still do in 2020, patient who hasn't seen a doctor in 5-10 years, okay, because they're busy taking care of other people. And when they come to me, sometimes it's devastating for me to do an exam and find that they have cervical cancer or a breast lump that hasn't been addressed, because you're so busy taking care of others that you forget yourself. But you can't be a service to others if you're not healthy, right? So one of the things that I also like to promote, especially now in the time of Corona, is a flu vaccine as well. Why am I encouraging a flu vaccine? Because that's one less thing you have to worry about during this time. It also helps us gauge whether or not this is the flu, whether or not this is pneumonia versus COVID, okay? And you can get access to treatment a lot quicker for the flu and pneumonia than you can for COVID, okay? And recover very quickly. I know a lot of people, there's a lot of myths out there. Oh, if I get the flu vaccine, I'm gonna get the flu. You're not gonna get the flu, okay? What it is, the flu vaccine is a killed virus, okay? It actually has half of the elements of the flu in it, but it's the half that provides you immunity to the flu, okay? So you're not gonna get the flu. You may get flu-like symptoms, okay? The muscle aches, the soreness, but you're gonna recover, okay? And you're gonna be stronger too for the next time a flu takes place in this area.
I have to confess, I just got my first ever flu shot just this year because of the myths. So you speaking on that, that's really, really important, because I saw a documentary once and I was like, yeah, I'm not going to do that. So I got one this year. So thank you.
And for women who have had breast cancer, lung cancer, any form of cancer, your immune system is already beaten down, okay? So you need to give it support, okay? And one of the things that you can do to support your immune system is get those vaccines that will help prevent you from getting those diseases later on. So very good for you, Sadie, for getting the flu vaccine. I will admit, as a medical professional, I was not one to regularly get the flu vaccine. Once I had a child, though, I realized it's not about me anymore. It's about me protecting my family, right? And so, again, think about those things when it's approached that it's recommended that you should get the flu vaccine, okay? Also, what I ask patients when they come to my office is, besides what's going on, anything new, I want to ask, how are you doing? That's usually my very first question. How are you doing? How are you feeling? Okay? Because the answers that I've gotten this year are so different than the answers I got last year. Before, I used to get, I'm doing great, Dr. Nyland. How are you? Now I'm getting, yeah, it is what it is. And this is taking a toll on us all, okay? And some people are able to manage it better than others, and some aren't coping well at all, okay? And they need to be able to seek out a medical professional, okay, who can guide them to the right resources. I'm not one to throw medicine at anybody, okay? I'm very conservative in that way. I think sometimes just talking it through with a counselor, starting from that end first, is usually what most people need and can get help with. If you need something more, obviously, there are medical professionals who can help you, and the counselors can guide you to those professionals as well. But most of the time, most people just need somebody to talk to, somebody who's able to listen to their issues and help guide them through those problems, okay? But if you're not open and willing, okay, to those conversations, then you're gonna suffer in silence, okay? And I hate to see that. You know, during COVID, this pandemic, we have seen an incredible rise in physical abuse, okay, domestic abuse, and child abuse, okay? And it's so sad. And if you see something, you need to do something. If you see somebody struggling, you need to alert them or alert somebody about that, okay? Because also the rate of suicide has gone up during this time as well. And so for me right now, that's kind of my main focus with my patients, to make sure they are mentally stable and healthy and well. And we're all gonna get through this, okay? I just try to remind them, as I leave them, I always tap them on the shoulder, stay well, be healthy, and vote.
Absolutely. We all have to vote now. So,
Yeah.
okay. Well, thank you so much, Dr. Nylander. I know we're gonna have a question and answer time now. So we'll be bringing you and Dr. Paas back in. We have an amazing facilitator, Morgan Williams Bryant, who will be joined by Marvin Sanford in our Ask the Doctor Q&A section.
Okay, the host had to unmute me. Good afternoon, everyone. Thank you so much for joining us. Thank you, Dr. Nylander and Dr. Paas. Such great information. Dr. Nylander, I have had flu shots in the past when I was volunteering at the hospital. And then through the myths, I've decided not to get them again. So you actually have my mind going. Maybe I should consider it again this year. So thank you very much for that information. We do have a few questions that people have left us that they want to know. And the first one is, if you've never given birth, does that increase your risk of breast cancer?
So there's an association between not having any pregnancies and the potential risk for increased breast cancer. But no one thing is going to definitely increase your risk for breast cancer. So when I was talking about all these things being multifactorial, that's what that means. So it's not a reason to have children or anything like that. You know, if you end up not having children, that's okay. It's just one of these things that can affect those estrogen exposures like we talked about, but it doesn't mean if you've never had children, you're definitely going to get breast cancer. That's definitely not at all the case.
Okay. Thank you very much for clearing that up. And the next question is, what steps after the breast cancer diagnosis should you take? What are some of the first steps?
So once you have a diagnosis of breast cancer, obviously one of the first things you want to do is be able to talk to your doctor, whoever it is that is guiding your treatment. And then they're going to be a good resource to let you know where the next steps will be. You know, what other appointments you need to set up, what doctors you need to see first based on where you are in your diagnosis. Finding good resources. So not looking up on Google just random things. There's so many bad sources of information out there and scary sources. And so it's really important to find those good sources that can help give you good information. I think just talking to someone as soon as you can, someone who has some information, is the best thing, because that time frame between getting a diagnosis and meeting with a doctor is really, really stressful for women. It's that not knowing, you know, what is going on. And even a day or two of that is stressful, let alone sometimes it can take a couple weeks to get a doctor's appointment. And that is very, very difficult for women. So I would, you know, try to, you know, get as much good information as you can in the short term, talk to people who have some, you know, who can help with that. That's important, I think. And yeah.
Okay, thank you. And we have a couple of good questions in the chat. What causes breast calcification?
So calcium deposits are real common on mammogram. It's not anything like that you do or anything as far as if you have too much calcium in your body or anything like that. It just, these deposits form because your breasts are mammary glands. And if you've had milk produced there, then over time these things can occur. And the calcium deposits actually can be different kinds of calcium. So it's just a normal finding. A lot of women have calcium deposits in their breasts on mammography, and only a small portion of that ends up being anything to be concerned about. But certainly based on the shape and the configuration, that's how we decide if those calcium deposits are just normal calcium deposits, if they are benign, or if it's something we need to address further.
Okay, thank you. And next question, what is a normal age to start menopause? And how do you know if you're starting menopause late, thus versus it being a risk factor?
So menopause is, first of all, a range, okay? You're not considered menopausal until you've at least not had a period for a whole year. But menopause can start as early as age 35 or as late as in your 60s, okay? So women can still have a period for a long period of time. I tell patients all the time, ask your mom when was around the time that she went through menopause. That's kind of a good gauge for when that may happen to you. Now, if you stop having a period around age 35, it is early, but it is something that we can absolutely work up and evaluate and make sure that your hormone levels are in the range where menopause is, or if something else is going on that could be causing those menstrual changes to occur.
Mm-hmm. And when you say workup, is it a blood test?
It can be as much as a blood test, ultrasound, and physical examination.
Okay, thank you. And we have another question around breast cancer and myths. Does holding your cell phone close to you or close to your breast cause breast cancer?
So there's no evidence of anything like that, obviously. I mean, I think generally they say when you talk on the phone or, try not to hold it too close to your head just for prolonged periods of time, because there's a lot we still don't know about some of these devices. So, it's important to use like a headpiece or something like that, because, there's still things we're learning about. Certainly if you when you have your phone, putting it in a purse or on a table is probably better than keeping it right next to your body all day, because like I say, there are things we don't know, but we don't have any kind of documented evidence about it.
Okay. And Dr. Posh, you talked about resources and not going to Dr. Google, but you also talked about that couple of day gap period before you can actually get into a doctor after you're diagnosed. What are some good resources that you would say, if you can't get into a doctor for at least a week or so, that people should target to get good information?
So some of the resources that I mentioned on the slide. So the National Comprehensive Cancer Network is very good. They have a specialized information packets just for patients. So they can explains things very well. And then, like I said, the breast360.org is a very good website that has resources for people. American Cancer Society. It's good to go to these reputable cancer sources as opposed to just putting in, a topic right into the Google itself or something and seeing the random things that come up. But those will help guide you. And then, it's always good if you've known somebody who's gone through it, sometimes that's helpful. Some women don't want to do that right away because it can scare them. So part of that, what resources are good for you will depend on what you respond to the best. Some people don't want to talk to people right away, and that's okay too. So it's kind of an individual thing also.
Thank you. We have one last.
Can I add to that?
Absolutely.
Because we'll get the pathology results sometimes before the patient is even told that they have breast cancer. So sometimes we are the first person that has to tell them, and it's usually over the phone, which can be very difficult conversation to have. I always frame it with, okay, where do you think you want to go for your further care or treatment? And I tell them there's various resources in Buffalo. I said, I tend to always kind of push Roswell first, but people are sometimes afraid of Roswell. Okay. And that's why I love Dr. Paz and her office, because it's still Roswell, but it's separated from downtown. And so that's kind of how I've been steering them sometimes. And they feel the care there, at least I know the care there is the same, but they don't have some of those, what am I trying to say? They don't have some of the fears of going to Roswell when they go to see Dr. Paz at her office on Park.
Hospital connotation.
Exactly.
Afraid of the hospital.
Exactly. Yeah. Roswell is intimidating. We know that. Yeah. Roswell is very intimidating to people. And sometimes some people aren't ready for it, or they've had a relative that they know went to Roswell and had a bad experience, through that. And so they're kind of apprehensive going there. So we guide them to the right places based on what they're looking for. And then if you could, Morgan, put those 3 resources that Dr. Paz listed, I don't know if you can, through the chat for the participants, just so they can see them again. I think that would be helpful too.
Okay. All right. Dr. Paz, if you can go ahead and write those links in the chat for us. And then we also can send those out to everyone that registered after this.
Okay.
And we have one last question in the chat. Are women with dense breasts at a higher risk of obtaining breast cancer?
So there actually is some data suggesting that if you do have dense tissue, you are at a slightly higher risk of getting breast cancer. And I just kind of think about it as dense tissue is just like functional breast tissue. So you have more of that actual breast tissue as opposed to just fatty surrounding connective tissue, things like that. So, and part of it is, initially it's harder to find with women with dense breast tissue, but there is a little bit of evidence that suggests that you are at a higher risk if you have dense breast tissue for getting breast cancer. So that's why it's important to have regular doctor visits, get this evaluated. One of the other things that I wanted to mention that I didn't mention is that, as women start going to OBGYN and have visits, it's very important to have that baseline evaluation of your risk, like Dr. Nylander was talking about. So generally by about age 25, we would recommend that every woman has just a baseline risk done to see what their risk of getting breast cancer in their life may be that can help guide what is recommended down the line.
Okay, so I'll take this one last question, and then what we do, if anyone else have questions, put them in the chat and we'll combine them all, send them to Dr. Nylander and Dr. Paz, get some answers for you, and then we can email them out later this week so you can make sure you have questions for yourself. But the last one is, does menopause cause your hair and skin to become more dry, and does it cause hair to be brittle?
So the answer to those questions is yes. Unfortunately, as you're losing estrogen and progesterone, your hair is starting to thin out. So it gets thinner. It's not as thick as it used to be. You'll see women older in age have thinning spots in the middle of their scalp. They get that male pattern baldness sometimes. And the skin does get drier because it's getting thinner. You know, estrogen is great. It plumps up our skin. It gives us a lot of moisture to our tissues. And as we're losing it, especially in the vagina, it gets extremely dry and thin and makes intercourse uncomfortable. Okay. So yes, those changes definitely do occur.
Okay. Thank you both. Again, you've done a great job. We have more questions coming in. Thank you, Dr. Poss, for putting those websites in the chat, nccn.org, breast360.org, and also the American Cancer Society website. Again, if you have any questions, please continue to put those in the chat. Marvin and I will monitor those. We'll get those over to the doctors and get some answers out to you later this week. And remember, please get a breast exam and do your own self-breast checks monthly. And we'll turn it back over to Sadie.
Thank you. That was amazing. That was amazing. I know some of the experiences that Dr. Poss and Dr. Nylander were sharing really hit home to me, because I remember when I was first diagnosed and you get this random phone call, and I didn't know the terminology. It didn't I was in shock. I was sitting there numb and in shock, and I don't know what that woman really said to me over the phone. And then there was this gap in between, okay, you got this diagnosis, but then what do I do now? Who do I call? Where do I go? Like, all of those questions are just, they're right there in your face. That's why at Sadie Strong, we're hoping that we can help women, also provide a little bit of support, and encouragement by talking to other women who have gone through the same experience, and, they may be able to help guide you. But the doctor is the first point of defense when it comes to that. And I want to thank both Dr. Nylander and Dr. Poss, because for me, they were both my personal my personal angels to help me through my process and my healing process. So thank you both so much. Thank you so much. So we're going to get ready and move forward with our program. We still have so much more. I want to talk a little bit about our Season of Giving campaign. So this year we were supposed to have our major fundraiser, our celebration of healing, but because of COVID, we weren't able to do it. So what we're doing now, starting today, October 31st through December 31st, we are having a Season of Giving campaign where we are raising money for Sadie Strong and our programs. We hope that you would support us through these initiatives. Whatever you can give, we ask that you give. Like yesterday, we were able to give a Sadie Strong love basket out to a woman. I shared that earlier, but it's through giving and your giving that we're able to do the programs that we have. So we hope that you would visit our website at www.sadiestrong.org to make a donation. There's no donation too small, and there's no donation too big. So as you prepare now, to wind up this year, and you need a tax write-off, Sadie Strong is a 501c3 tax exempt organization, so you would get a tax credit. So please consider us, Sadie Strong, in our Season of Giving campaign. Thank you so much. Thank you so much. We got Sonia. Oh, Marvy and Sonia are here. What do we have going on, Sonia? As Sonia gets her audio together, we're going to get ready for our fitness demonstration with Karen Bryant from Queen City Fitness Club. But before we do, we have a couple of giveaways. We want to thank you all so much for just joining us and registering for our event. And we want to give you some thank you gifts for participating. So we have a couple of lucky winners. And I was Marvy, are you available to tell us who our winners are of our Sadie Strong giveaways?
Yes. All right, the wheel is spinning. And our first winner is...
Drum roll.
Our first winner is Charmaine Gray.
Oh,
all right. Congratulations.
Congratulations. And we had, was it 2, correct?
Mm-hmm.
Yes.
All right. Wheel is spinning. Number 2. And our second winner is Kendra Washington. Congratulations.
All right. Can you hear me now?
Yes, much better.
Oh. All right. So we're getting ready to move into the next phase of our program, which is probably my favorite, well, second favorite phase. But we're going to get ready to get into a little workout and fitness with our Queen City Zumba master, Karen Bryant. And for those of you who don't know, Karen runs Queen City Zumba, and you can join her on Thursdays online. And she is live, and she does a little fitness workout, and she gets you moving and grooving and sweating and all that good stuff. And, before COVID, me and Sadie were faithful. We were going, we were getting it. We was doing our thing, weren't we, Sadie?
We were
getting it. So are we, do we need to take a quick break so people can get some space?
Yep. And before we do that, we want to, for those giveaway winners, we will reach out to you via email to connect with you to give you your prize. And Marv would also like to talk about Sadie Strong merchandise and social media as you get ready for our Zumba exhibition.
All right, yes. So hello, everyone. I'm Marvin Sanford. I'm Sadie's son, and I'm also on the board. I did want to just, while everyone is getting ready and getting their space ready and putting on those stretch pants so that we can do some Zumba, I just wanted to talk to you about Sadie Strong merchandise. So if you look here on the screen, you can see that we do offer a variety of t-shirts, both long and short sleeve, as well as hats with our Sadie Strong logo. So we are in the process of working to get an actual store online, but in the meantime, we do still offer the merchandise. So if you are interested in t-shirts, whether short sleeve, long sleeve, hats, we have pink, black, light pink. And we'll have some more things coming definitely soon. And you can see we're all rocking it right now. If you are interested in purchasing Sadie Strong merchandise, please email our account at Sadie Strong. Oh, you can see the email here, sadiestrongproject@gmail.com, and we can coordinate with you just on how to make the purchase. It's really easy. We have Square, so we can do mobile payments. We can also pay with check, however you want to do it. We can coordinate that with you and send it over to you, mail it to you, or if you're in the Buffalo area, offer pickup. So that is that. We also want to talk to you all about social media. As you can see here, please, please, please make sure that you're following us and keeping up with us on our social media accounts. You can see all of them listed here, and I'm also going to paste links to them in the chat as soon as I'm done speaking. But on Facebook, you can visit us at Sadie Strong Project. On Twitter and Instagram, we are at I am Sadie Strong. Again, Twitter and Instagram, we are at I am Sadie Strong. And then on YouTube, we also are, we have the link there as well, Sadie Strong on YouTube as well. So please follow us on all of these accounts. This is where you can get all the most up-to-date information on Sadie Strong, all of our upcoming events, get information on how to get involved, how to donate. We have blog posts. We feature new things on our website all the time. So please make sure to follow us on all of these accounts, as well as checking us out on our website, www.sadiestrong.org. And that is it. And I did see that Karen said to make sure you all have on sneakers for the Zumba.
Yeah.
Make sure you have some space. I've done this class before, and I'm really excited for it. So turn it over to Sonia.
So this is going to be a modified class because, normally Karen has us sweating and, gasping for air and, all kinds of stuff like that. But she's going to take it easy on us today. So this is just to give you guys an idea of how her class goes. And she has different classes for different levels. So whatever level you're in, You know, if you want to be that super person like I try to be, or if you just want to chill and be modified, she can accommodate everything. So if you're interested in signing up for her classes, her email address is qcfitnessclub@gmail.com. And it's in the chat. It's qcfitnessclub@gmail.com. Classes are extremely reasonable, and she is an excellent teacher, wonderful instructor, and I just love it. So are we ready, Sadie? Are we ready to get moving?
I got my shirt on, so I'm ready.
Wonder Woman on us.
You see that? And look, I've been running. I lost a couple pounds. I might have to get a smaller size shirt.
Oh, look at her. Okay. Look at her.
Let's go. Let's show you.
We know a lot of people got some COVID pounds that they need to get off. So let's get this little workout in real quick.
For me, position in the dance, get in line for me. Back it up and a bump and grind. Back it up, girl, rotate your waist, back it up. Hand on them in a yes, back it up. Girl, you want to resist, back it up. Are you a win this a case, back it up. Like a wine in a tabis, back it up. That shape they a shut down the place, back it up. Back it up, back it up, turn it up. Show me what you got it. Some girl out of luck. Back it up, girl rotate your waist, back it up. Hand on them in a yes, back it up. Girl you want to resist, back it up. Are you a win this a case, back it up. Like a wine in a tabis, back it up. That shape they a shut down the place, back it up. Back it up, back it up, Wanna smoke with me? Then
turn this mom up 800 degree. Whole team eat chefs cause she's a treat. She's so bougie, bon appetit. I'm a savage, attitude nasty. Talk big, but my bank account match it. Hood, but I'm classy. Rich, but I'm ratchet. Haters kept my name in their mouth, not a gagging. Bougie. He say the way that thing move, it's a movie. I told that boy we gotta keep it lowly, me the room key. I done bled the block and now it's hot the tunchi. I'm mood and I'm moody. I'm a savage. Classic, bougie, ratchet. Sassy, moody, nasty. Acting stupid, what's happening? What's happening? I'm a savage. Classic, bougie, ratchet. Sassy, moody, nasty. Hacking, stupid, what's happening? What's happening? Hips tick-tock when I dance. On that demon time, she might start her OnlyFans. Big B and that B stand for bands. If you wanna see some real baby, here's your chance. I say left cheek, right cheek, drop it low and swing. Texas up in this thing, put you up on this game. I be parking my frame, gang, 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 gang. If you don't jump to put jeans on, baby, you don't feel my pain. Please don't give me hype, write my name in ice. Can't argue with these lazy basics, I just raise my price. I'm a boss, I'm a leader, I pull up in my two-seater, and my mama was a savage. You got this here from Tina, I'm a savage. Yeah, classic, bougie, ratchet. Sassy, moody, nasty. Acting stupid, what's happening? What's happening? I'm a savage. Classic, bougie, ratchet. Sassy, moody, nasty. Hacking, stupid, what's happening? What's happening? Like Beyonce, like me. He wanna punch like the stallion with the knees. He be like, damn, how that thing moving in the jeans. Even D4L couldn't do it like me, like me. Ooh, I got this body ready just for you. But I hope you don't catch me messing around with you. Talking to myself in the mirror like, since you my boo. I need a mop to clean the floors, too much drip. Oh, I keep a knot, I keep a watch, I keep a whip. Oh, let's play a game. Simon says I'm still in check. I'm still in black. I'm a savage. Classic, bougie, ratchet. Sassy, moody, nasty. Acting stupid, what's happening? What's happening? I'm a savage. Classic, bougie, ratchet. Sassy, moody, nasty. Hacking, stupid, what's happening? What's happening? They asking for the queen to buy some cameras in here. I'm a bad bitch, he's a savage, no comparison here. I'ma flip my hair and look back while I twerk in the mirror. All this money in a room, think some scammers. I keep it juicy, I eat that lunch. She keep that booty, she keep that plump. That natural beauty, yeah. If you could see it from the front, till you see it from the back, back, juicy, back, yeah, back, juicy, back, juicy. If you could see it from the front, till you see you in the back, yeah. You like it thick, you like it fat, yeah. Like to keep on wanting more. He asked me, Doja, where you at, huh? Then all the wanna know how long it take to put my pants up. Poke a fingernail and then some. Tryna squeeze into my true religion, that Said the beat don't wanna say you like. I don't buy it what it say you like. He said the body unbelievable. Can't trust a big but in a Gemini. I keep it juicy, I eat that lunch. She keep that booty, she keep that plump. That natural beauty, yeah. If you could see it from the front till you see it from the back, back, juicy, back, yeah, back, juicy, back, juicy. If you could see it from the front till you see it from the back. Been at it, sober Doja, bring it back. I'm a big dog tryna eat the kitty cat. I'ma slide in the way it fit. I could tell we match. All about my racks, hella cheese, I don't for racks. Big baby in Hollywood, I don't even act. Come relax, let her the tap. What you wanna act? Take a low with the pop, wipe the pain away. Juicy and it's tighter than a virgin, like Madonna say. I love when you give in, I love when you don't. Hit me with the threesome, and sometimes you won't. You told me don't with no
did you know? Nah. You got it, yeah, you got it, baby. Bust it on the floor.
I keep it juicy, I eat that lunch. She keep that booty, she keep that pump. That natural beauty, yeah. If you could see it from the front until you see it from the back, back, juicy, back, yeah, back, juicy, back, juicy. If you could see it from the front until you see it from the back. He need the rump and need the thighs. He eat that up and in the night. He see that in the dark and in the right. He keep it running like a pump. He need the rump and need the thighs. He eat that up and in the night. He see that in the dark and in the right. He keep it running. I eat that lunch. She keep that booty, she keep that pump. That natural beauty, yeah. If you could see it from the front until you see it from the back, back, juicy, back, yeah, back, juicy, back, juicy. If you could see it from the front until you see it from the back.
All right, that was amazing.
Woo.
That was
Gotta catch
amazing.
my breath. That brings back memories. That brings back memories.
Everything.
Thank you so much, Karen Bryant from Queen City Fitness Club. Listen, whew,
Love it.
I love it.
We
need to make sure that we are exercising at least 30 minutes each day. And if you want more information about Queen City Fitness Club, you can look at their information is in our chat right now. You can also find a link to donate in our chat. But this has been a great day so far. Like, I'm really having a great time. I hope you are enjoying. We still have more. We still have a little more. So we got to get to Sonia's favorite part now. So we're going to get to Sonia's favorite part. Thank you again, Karen, from Queen City Fitness Club.
Yes. Do we have time to do a poll before we get to my favorite part?
Yes. Let's do a poll. Okay, so now you all can get involved. We got a poll.
Oh yeah, we don't just to be about us. We want to get our audience involved. So we have some poll questions that we would like to bring up so you all can participate. So our first poll question says, do you feel exercise is important? And you can just click yes or no. And our second question is, do you exercise? A lot of us don't exercise. So, just be honest with yourself. No one knows, your story, but do you exercise regularly? And then our last poll question is, do you feel better when you have regular exercise routine? Like, do you, does it make you feel good? Some people, that's how they get their day started. And if they don't exercise first thing in the morning, their day is not good, or some people do it at night. So what is your exercise regimen and routines? Okay, something to think about and something to, keep you going as we're giving you all this information here. Things to think about.
You have to be honest with yourself. Exercise is such an important part of our life and our health and our wellness. And so we just have to figure out what it is that we want to do, and we have to commit to ourselves. I know.
What have you started doing?
Well, last year I ran my first 5K ever. I would see the people in the neighborhood running by with their little ponytail, and it would bop by, and I'm like, I really want to do that. And one of our board members, Alicia, invited me to participate in a run club to learn how to run a 5K. And I was like, yeah, let me try this. And last year, after going through breast cancer and all of that I went through, I ran my first 5K. And since this pandemic, I started running again. I've been exercising basically every single day. We started riding bikes. And so you just really have to find what it is that you enjoy doing and commit to yourself. So we're going to continue to inspire healthy lifestyles. We did workout Wednesdays this summer, and so many people started and posted pictures. And so we're going to continue to encourage people to get moving. So look at our poll. I love it. So the people that know they don't exercise, we want to encourage you. If it's walking, take one step at a time and do what it is that you enjoy.
So even this summer, like during COVID, we were like, okay, what can we do to stay active and motivated and, just staying, connected, because, we were going through connection withdrawal because we're so used to seeing each other. But we started riding bikes. Like, who would have thought at 40, 50 years old, we were out here riding bikes every single Sunday morning. It was amazing. It was absolutely amazing. And we started promoting different groups and we invited people to join us, and it was just a lot of fun. Social distancing, of course, right? We had our mask, but we were riding bikes every single Saturday morning. It was so much fun. So like you said, it can start with a little walk, or you can start with a jog, or ride, whatever your comfort level is, go for it.
And we're going to pick some things back up in the spring. So I got a lot of great ideas. We got another quick poll for you before we move forward, because we know that breast health is very important. So we want to just understand where you are with regards to your mammogram. So women, if you're age appropriate for mammograms, please share if you choose to. If you don't feel comfortable, then that's perfectly fine. So have you had your annual mammogram this year? If you haven't, are you scheduled for one before December? Because if you haven't and you're not scheduled for one before December, we want you to take some time on Monday to make an appointment. And also, do you complete your monthly breast checks? So Dr. Paz did an amazing job showing us how to do it. It's something that we have to continue to commit to ourselves. And if you haven't, let's start now. And, I hope that through Dr. Paz's, her presentation that, she made you feel a little bit more at ease with regards to the mammogram and the mammogram process. So, we want to encourage you. It might be painful for some, but you know what? For me, had I not gone to get my annual mammogram, I may not have known that I had breast cancer, because I was feeling fine. I had just celebrated my 50th birthday party, and it was just like, hey, I was excited. And I didn't realize that I was walking around with breast cancer. So please, ladies and men, the women that you love, make sure that they're taking care of themselves and getting checked. And
that's right.
You might even be able to help them with the self-breast exam. Oops.
This is a G-rated show.
I'm sorry. But yes, monthly checks, mammogram. Look at that poll. Come on, I see too many no's. I see too many no's in that had your annual mammogram. So if you're of age, please do so.
That's right.
Now let's move on.
All right, here comes my segment here. It's time to eat. So we are now going to have a little fun in the kitchen with our very own chef Chelsea. She represents Dash Catering, and when I tell you Chelsea is absolutely amazing, she is amazing. She had me eating food that I didn't think I even liked. I'm picky, but it was so much fun being with Chef Chelsea. So we did a cooking demonstration with her, and we're going to play that for you now so you can get you some tips on how to eat healthy, because along with exercise, we got to eat healthy too, right?
Yes.
Hello and welcome back to our Sadie Strong Expo. I hope you've enjoyed so far with us the chat with the doctors, and now we just worked out with Zumba, and now for the best part, food. Yes, so we are here with Miss Chelsea Wooten, who is the chef for Dash Catering. So Chelsea, tell us what we have today. What are we going to eat?
Hi everyone. So as she said, my name is Chelsea, and here today we're going to be making burrito bowls, specifically chicken and shrimp. So what we're going to do is get started, get in right here. talk about the rice, right? So the rice is one of the most important parts. It's the base of everything. Of course, if you want to go low carb or keto, we have the option of lettuce wraps. So with the rice, this is brown rice we have here. So in this, we have salt, garlic, there's lime juice, and there's also cilantro. So that'll be the base of your burrito bowl here. Now, what we're gonna do next to build everything is get our proteins squared away. So the first thing we're gonna do is start with our chicken. So here we've got chicken breasts. I pounded them out with a meat pounder, but you can do whatever you like, you don't have to. But we're gonna get ready to prepare it. So the first thing first is the taco seasoning. So I know everyone goes to the store, you go to Walmart, you go to Tops, you go and get your taco seasoning from El Paso or what was the other one? Ortega. But they actually have a lot of ingredients that can be harmful to your body. So here we actually have a homemade taco seasoning. So in here is paprika, it's chili powder, there's garlic powder, there's onion powder, cumin, black pepper, oregano. So this is true to taste. I find this to be delicious. So here we're gonna go ahead and add it to the chicken breast.
Sprinkle it right on there?
Yep, so what we're gonna do actually is take a little bit of olive oil. So you can take whatever oil you want, avocado oil, grapeseed oil, whichever you prefer. And you're just going to drizzle a little over the chicken just to coat it so the seasoning sticks. And then you're gonna go ahead and take the taco seasoning and generously season your chicken.
I like that word, generously.
Generously, yeah, you gotta be generous with your chicken. Yes, you gotta love on it. Yes. So once you do that, you're gonna season everything and then you're gonna mix it together. And we're gonna do it on both sides.
No more oil, you don't need to put oil on that side?
Nope, you're gonna, because you know what, we wanna reduce the calories.
Oh, okay.
So, you know, just for healthy, reasons, we're just gonna limit the amount of oil that we put on the chicken for now. But you know, if you don't care, you can put more oil on.
So it depends on what diet you want at the time.
Right. So what we're gonna do now is just add a little fresh element to the chicken. So we're gonna incorporate lime. You can also do lemon if you like, but we're gonna do lime today. And right here, I have a citrus squeezer, so you can pretty much squeeze the juice out of a lemon or a lime, and it'll, be a lot easier for you.
Okay, now, so for us common folks, if we don't have a citrus squeezer, what do we use?
You can use your hands. Use what God gave you, okay? You use your hands. So
just checking.
We're just gonna squeeze it over the chicken. This is half a lime. Depending on how much chicken you're using, you can use more. But you're just gonna squeeze a little bit of the lime juice over the chicken just to give it some razzle dazzle, if you will.
Razzle dazzle. Oh, we gotta be fancy cooking this stuff. Okay, Chelsea.
All right, guys. So now we're gonna go ahead and start preparing the chicken. So first things first is that we have a grill pan. So
let me ask you a question. Yeah. Because some people may not be eating meat right now. Is there another option? Can you do something else?
Oh, absolutely. Yeah, you can do shrimp. If you want to do a veggie option and just veggie, it's up to you. Completely up to you. But for right now, we've got the chicken and the shrimp. We do both if you want. It's up to you. We're gonna go ahead and get this going because now your grill pan is hot, it's smoking. So we're gonna go ahead and put the chicken in. You hear that sizzle?
Yes, sizzle, sizzle. Sizzle and smell. Yeah,
So now that's in here. If you don't have a grill pan, you can also use a George Foreman, that works well. Or you can just sear it, just regular sear in the pan.
Right?
Yeah, in a frying pan, it works just as well. It's all about the flavor, So here we go.
With COVID, we don't have all these fancy items to cook with, so.
It's okay. So now what we're gonna do is go ahead and cook the shrimp. So I already have some shrimp here that's been pre-seasoned with taco seasoning. That's homemade. So we're gonna go ahead and put this in a regular cast iron skillet today, guys.
And that's the same taco seasoning mix that you use for the chicken?
It's the same one. So again, here are some of the ingredients that we have for it. We've got the garlic, we've got black pepper, we've got onion, we've got chili, we've got oregano, cumin, paprika, and we've got cayenne, and of course, salt to taste.
All right.
So I'm gonna go ahead and put the shrimp in here now.
It's smelling good up in here.
Oh, that's good. Looks like we'll have to check the chicken in a minute. All that's heating up. Okay. A few more minutes on that.
So now, what kind of heat are you cooking your chicken on?
So right now it's on medium-high heat.
Okay.
It was on high just to get the pot, going and get it smoking. But once you start getting that sizzle, you're gonna want to turn it down a little bit. We're gonna grill it, and then we're gonna make sure to get those nice grill marks. And we're gonna flip it. I say generally anywhere from 4 to 5 minutes. What I like to do is put it in the oven to finish it off. That way it stays juicy and you won't, have dry chicken on your burrito bowl. So now we've got the shrimp. So again, this is already pre-seasoned. So we're gonna go ahead and get this going.
Does it matter the size? Big shrimp, little shrimp, jumbo shrimp?
Yes, you can do any size you want. Now these here are jumbo.
Okay.
So you can do, little shrimp, baby shrimp. You want to do cilantro, So extravagant, So I'm going to go ahead and check the chicken. So I see that the grill marks are starting to form. So we're going to go ahead and turn it this way. Oops, there we go. So we get those same grill marks. And turn it down just a little bit. And we're gonna wait on that to cook. So we've got our chicken going, we've got our shrimp going. Now the shrimp don't take very long at all. You really want to just cook them until they turn pink. Otherwise, they can become rubbery and you're not really getting the pieces you want. So we're gonna go ahead and finish those. I'm gonna go ahead and flip this over. Let's see.
Cooking a lot about presentation. You want it to look pretty as well as taste good.
Right, definitely. So we've got that going. We've got the shrimp going.
So shrimp is done. Put that in the pan. So now what are we doing with the chicken?
So now we're gonna go ahead and put the chicken in the oven for a few minutes. So we've been cooking it for about 4 to 5 minutes. So I'm gonna go ahead and put it in the oven for another 10 to 15 minutes. I do put a little chicken broth in the bottom just so that it stays moist. And that way your chicken won't dry out.
Now, if you have a regular frying pan, can you put that regular frying pan in the oven like that?
As long as it's oven safe.
Okay. Okay, so we got the shrimp, you did the chicken, and now what we have next? What's the next step?
So now I just want to segue into meal prep.
Oh, good. People are into that now. That's the new thing.
Yeah, so a lot of people don't want to cook nowadays, and they are looking for companies that meal prep and offer services for meals throughout the week. So, you can always choose that. Or if you want to meal prep at home, you can also do that. So, with that being said, I have a few tools that you can use to help you along the way. So the first thing first is the meal prep containers. Now these are the circular ones, but they do have containers in different shapes. They do have ones that are rectangular, more oblong. So depending on what you're looking for and the size, you can choose your container. They do sell them at Walmart. They also sell them at Wegmans, Tops, Sam's, any wholesale, BJ's, anything like that. You can buy them there. You can get them in bulk for pretty cheap. So I would recommend that.
Now, does Dash offer meal prep services?
Yes, so Dash does offer meal prep services. So it's a weekly meal prep setup. So what you do is I review the menu and send it out on Monday. You place your order by Wednesday, and pickup or delivery is on Sunday. So you have the option to choose from 5 to 10 meals, whichever you choose, or you actually have the option now to do a monthly subscription. So if you do want to sign up for a month, you can do that as well.
But if we broke and we try to do it ourselves, what do we do?
Yes. So if you don't wanna do that, you can always do it yourself. So the first thing I always want to tell you is foil pans. Foil pans, the sheet pans, are your best friend. A lot of the time, you can roast and really do like the one pan meals. Those are really simple and easy. So I recommend getting some of those if you don't have them. Again, they have them at Walmart, Target, any grocery store. They even have them at the dollar store. So you can always go there. Then secondly is the handy dandy rice cooker. So I live by this. I love rice, but for those of you who are struggling, because I know a lot of people have a hard time cooking rice, a rice cooker will save you a lot of time, a lot of energy, and you won't have to worry about your rice sticking to the pot or burning. So this is a larger one, which you can do brown rice, white rice. You can steam also with this one, but they have a different variety of them, different sizes. So depending on what you're looking for, you can always go again to Walmart, Target, even if you want to go on Amazon and look it up, you can always find a rice cooker. I do suggest also going to the Asian markets. They do sell them for cheap. So if you did want one, I suggest going there. And then the last is the George Foreman grill. So I know depending on what size you're looking for, you can buy this. It's a grill, and it does help with the fat intake and the amount of calories that you consume. There's usually a little shelf at the bottom that will hold all of the fat deposits. So you can really see that what you're eating is a lot healthier. So I do recommend that. And getting that. So if you can, again, they have them at Walmart. You can get them online. Wherever you need to go, you can do that. If not, of course, you're always, able to use your regular stovetop oven, and that works just as fine.
So Black Friday, we need to be looking for a rice cooker and a George Foreman grill.
Yes.
Got it.
Yes. So if you do need any other tips, you can always contact me. I'm always willing to give free information. If you're willing to meal prep and do it yourself, or if you want to contact me to reach out to use my services, I'm also available as well. You can follow me at Dash Eats on Instagram, and you can also follow me on Facebook at Dash Catering.
Okay, so we got our meal prep going. So now, how do we build these burrito bowls so we can eat?
So we're gonna do rice. And don't forget, instead of rice, you can always do quinoa if you like. You can do cauliflower rice. That's always a lower carb option.
Now, what kind of rice did you use?
This is brown rice.
Oh, okay.
So I use that, but you can use whatever you choose. And now we've got more pico. Okay, now the protein this time is chicken, so we're gonna add some chicken.
And the good thing about building your own, you can put what you want in it, what you don't want in it.
Absolutely. So if you don't want cheese, if you don't want, sour cream, if you don't want guac, you don't have to put that on there. I'm gonna add some more.
Now, what would you say altogether? What would be the total prepare time for this whole meal?
I would say in total, prep time is actually pretty quick. It's about the whole thing, maybe about 30 to 45 minutes. Not too bad. And we can't forget the black beans.
Oh, you got beans last time. All right.
Yep, so we're going to go ahead and add the black beans. And last but not least, we've got the sour cream, and we've got cilantro. lime and everything. Don't forget the fresh lime to squirt on top.
And again, can that be lime or lemon, or do you recommend lime?
I do recommend lime just for the flavor profile, but for the guacamole, if you wanted to add lemon in there, that's also an option. In the pico, that's also an option as well, but generally lime is better. Okay. So we are done with that, and that was our meal bowl.
Well, we'd like to take this time to say thank you, Chef Chelsea, for this wonderful meal prep demonstration and meal bowl demonstration. Everything looks beautiful and wonderful. It tastes great because I already ate mine. So we'd like to thank you. We congratulate you on your business. We wish you nothing but success and everything that God's gonna bless you with. And this is a healthy meal too, because we're out here promoting healthy lifestyles and healthy wellness and fitness. So this is something that you can fix 30-35 minutes when you come home from work. Get it done, get it cooked, and live a healthy life and eat good at the same time. Again, thank you, Chef Chelsea. We appreciate you, and thank you all for watching. Woohoo! Sadie,
so
the bowls were amazing.
I know Chef Chelsea is amazing. Last year at our event, she made zucchini noodles with a turkey spaghetti sauce, and like she's an amazing chef. And it's simple. Like she makes it look so simple.
Yes, it was excellent.
Yes, yes.
So much fun. She's such a professional, just getting started. So please go check out her Facebook page, her Instagram page. You won't be disappointed, I promise.
Absolutely. And she makes this soup okay, I'm gonna let it go. But you know, when you're kind of hungry, I guess we went over the lunchtime, right? So it's like Marvin is talking about, it's hard to watch this cooking segment when you're starving. So, but it was great. And we have just had such an amazing day today. Like, I don't know about you all, but it has really been something special today. You know, I didn't know when we knew we had to shift to this virtual platform, if people would participate. But we have people from all across the country that have been on our call today, like all across the country. So my battery is blinking here, so I'm going to have to get my tech support husband to come in and change my lighting. But in the meantime, I am just so excited and overjoyed, and I want to take this time to really just thank you all for joining us today. I want to thank you for spending time out of your Saturday to come and support our second annual Sadie Strong Health and Wellness Expo. Really, this is our labor of love, and we are doing this just to try to help promote healthy lifestyles. You know, I want to take some time to thank a few people. First, I'd like to thank our sponsors, our Pearl Hope sponsor, Breast Care of Western New York. We want to thank our love sponsors who helped us to give our Sadie Strong Love Box yesterday. Our love sponsors are Buffalo OBGYN and Giannotis Tax Service. Our Pearl sponsor is Breast Care of Western New York. We also want to thank our amazing panelists. We had some amazing panelists, Dr. Mariola Paz and Dr. Emikule Nylander. We want to thank Karen Bryant of Zuma Fitness Club. We want to thank Chef Chelsea Wooten of Dash Catering. I also want to give a shout out to Laquita Shedrick, who did our flyers. I want to give a shout out to Marvin, who is our video extraordinaire. Like, he puts together, if you were there for our prayer walk earlier in the month, And everything that we've done, he's put these videos together. And I'm telling you, God is using him, and he's gonna, I'm claiming and declaring it right now that that Marvin, God is gonna bless you, and you're gonna be blowing up when it comes to that. I also want to acknowledge our the Buffalo the Challenger News, as well as the Buffalo Criterion News, who have articles about Sadie Strong in their paper this week. So if you haven't had a chance and you're in the Buffalo area or online, log in, pick up a paper, and check us out. Now, I couldn't do this event like this without technology. So Jasmine Foster has stepped in. I've known Jasmine for years and years and years and years, and watched her grow into this amazing woman. I mean, she's just phenomenal. And she did all of our technology today. And, you know, she did a phenomenal job. So I want to give kudos to Jasmine Foster for all her work in our technology area. And, you know, an undertaking like this wouldn't be possible without the bomb planning team. And so I want to take time right now and recognize the Sadie Strong board. So we have, let's see, can we get a gallery view? Because I'm just looking at Sonia right now. Is it just me, or does everybody have to do? I have to go in myself?
You have to.
Yep. Yes, because I was just seeing Sonia on the face. So I want to thank our Sadie Strong board. So we have, and I'm going to go based on who I see. Morgan Williams Bryant. We have Marvin Sanford. We have Stephanie Cowart. We have Janelle Varner. We have Sonia Croxy. And we have Leisha Pryor, the Sadie Strong board. So without them, you know, I don't know where I would be. They just lift me up. They support me. They listen to all of my crazy ideas, and then we run with it. And if you've been to a Sadie Strong event, and you have today, you'll see that, you know, when we do things, we do them well, and we do them with excellence. So thank you, board. Thank you for loving me and supporting me. I don't want to cry, but thank you so much. From the beginning, you have been there and supported and said, what do we need to do? So make sure you surround yourself with people who lift you up. I also want to remind you, before we close out our program, about our season of giving. Please consider making a donation to Sadie Strong. It's a great tax write-off. I know I make a lot of donations to a lot of organizations. We're going to do something cute on Giving Tuesday in December too. So look forward to that event. It's going to be like a old school kind of party, because, you know, I like to do something like that, but it's going to be via Zoom. So look out for that.
And the link, just so everyone knows, the link to donate, I just typed it in the chat. So if anyone would like to make a donation to Sadie Strong, that link is in the chat function. So please make donations. We would appreciate it. You can share that link with anyone. It's also on our website, sadiestrong.org/donate. It's on the homepage as well. So right there, easy for everybody.
Absolutely. Also, speaking of our website, I want to give a shout out to Red Solutions. Red Solutions is an amazing tech company that does our website. I mean, amazing. Red, R-E-D-D Solutions. So support them. We'll put their information in the chat as well. And right now, just once again, thank you so much for supporting our second annual Sadie Strong Health and Wellness Expo. And what I want to encourage you to do today is be the reason why someone smiles today. God bless you, and to God be the glory. Thank you all. This was good. Woo.